Together we achieve victory over heart failure.
Hi everyone, my name is Dr. Kabir Sethi and I'm currently working as a consultant interventional cardiologist at Delhi Heart and Lung Institute, Pachkunya Road, New Delhi. And I welcome you all to this podcast for debunking certain myths surrounding the clinical concept of heart failure. Now, before we get on with this, let us first understand and learn some of the interesting aspects regarding this clinical syndrome of heart failure. Now, whenever we say heart failure, we must understand that we are talking about a disease entity which is widely prevalent in the world. And if we were to talk about the Indian population, we have nearly about 1% of our population at present who is living with heart failure. So if we were to convert this into numbers, we have about, say, 13 to 14 million Indians as of now who are currently living with this clinical syndrome of heart failure. So therefore, it becomes extremely important and relevant for us as physicians to basically educate the patient as well as the patient's relatives regarding the basic concepts surrounding this clinical entity of heart failure, and we must try and debunk the large number of myths which are surrounding the heart failure disease. So let's first take up, although there are a number of myths surrounding it, and it's extremely impossible to clear out all at once, but I'll try to take the most relevant ones today and try to clear out the fog of misinformation that has been going around and has been picked up by a number of patients who are living with this clinical entity. Now, oftentimes, when individuals first time learn about the fact that they have been diagnosed with heart failure, they simply think that, oh my God, my heart has completely stopped working. Well, that's a huge myth surrounding this clinical entity of heart failure. When we say heart failure, it does not mean that there has been a total shutdown of the heart. See, if your heart completely shuts down, it won't be compatible with life. You'll stop living. So it simply means that your heart is currently struggling to pump the blood efficiently throughout your body. And one must try and figure out the cause as to why this is happening with your heart. Schedule an appointment with your clinician and try and understand in great detail as to what has gone wrong, and try taking counter remedial measures to treat the underlying etiology and reverse it to whatever extent it is possible. Now, the next myth that often surrounds this clinical entity is that heart failure only targets the elderly. Well, while heart failure is more prevalent among the elderly population, certainly because they are living with more comorbidities, the risk of certain arrhythmias such as atrial fibrillation increases as the age advances. But we must understand that heart failure can strike anyone at any age. It's a constant interplay of your genes, your lifestyle choices, your underlying health conditions, your significant medical history in the past, and all of these put together contribute to its onset, making it a concern for individuals for all ages. So it's completely untrue to think that I am young, so which means that I cannot ever suffer from this clinical entity of heart failure. No, that's wrong. When you're young, your odds are less, certainly in comparison to the elderly population, but that does not mean that you are completely protected. So eat healthy, get your medical checkups done periodically, and control your comorbid conditions. Oftentimes, people also think that once I have suffered an episode of heart failure, or the fact that I'm living with heart failure, I should not exercise at all. Because if I exercise, my clinical condition may deteriorate. Well, again, that's a big misconception surrounding this. Exercise, in fact, is a cornerstone of heart failure management. When done safely and under professional guidance, it can absolutely bolster your cardiovascular health, boost your endurance, and significantly contribute to your overall well being. However, we must understand the exercise should be graded. It should be under strict professional guidance. One should not do things or experiment with themselves thinking that the other person who's probably not living with this clinical entity has got a better endurance. One should not try and mimic any of these individuals and should absolutely seek advice and guidance from their healthcare provider. So, yes, it's absolutely untrue to think that if I have heart failure, I cannot exercise. You very well can, but you must seek absolute professional guidance for the same. Lastly, patients who have been smoking for a very long time and who are also living with this clinical entity of heart failure think that if we quit smoking now, since we have been smoking for that long, it's of no use, it's of no benefit, since we have already been diagnosed with heart failure. But one must understand that this is completely untrue. The moment you quit smoking, the moment you give up on this habit of smoking a cigarette or a beedi or a pipe, regardless of your age and regardless of your smoking history, the time that has lapsed since you started smoking, the benefits kick in right away. In fact, within just 1 year of quitting, your risk of heart attack starts coming down. In fact, almost goes down by about, say, 30 to 50%. And in a decade's time, it mirrors that of a non smoker. So, yes, we must consider quitting smoking whenever we can and at the earliest if we want the benefits of medical treatment as well as the procedures that we undergo to kick in. So, with proper care and treatment, individuals living with heart failure can absolutely lead a fulfilling life, navigating their condition with resilience and determination. I hope this information has been helpful for you all. Thank you for listening.